The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with Apina of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary Faye Axon Armstrong.
Aloha! Magandang gabi po sa inyong lahat. Maraming salamat po sa inyong pakikinig sa aming programa. I'm your student, Dr. Mary Faye Axon Armstrong, founding president of the Asian American Pacific Islander Nurse Association of Nevada, and I'm also a professor at Roseman University College of Nursing. Here we are again on a Monday night. And thank you again for listening to us at your hapagkainan or dining table, or maybe you're driving somewhere. Make sure that you wear your mask. The governor said it's a mandatory. So I was trying to look for my mask, but I'm at home right now, so I don't have to use it, right? So do you know that June is Men's Health Awareness Month? And that's why tonight's episode has to do with male. And I thought I invite our male nursing students who can share with us their perspective about being a male nursing student and what they can contribute to the community. So tonight I have students from the three known School of Nursing. First, I have Vincent Ray Tejada from Roseman University College of Nursing. Say hi, Ray.
Hi, good morning.
And I also have William Gangozo from University of Nevada in Las Vegas School of Nursing.
Hello.
And also, last but not the least, I have Brandon Niff from Nevada State College.
How's it going?
Hi. So these are our male nursing students. Welcome to Healthy Mondays with Pina of Nevada. So there are so many questions that I sent them to ponder upon. But first of all, I wanted to have our listeners hear about the reason why they want to be a nurse. So we'll start with Vincent. So what prompted you to go in nursing?
So actually, I never really thought I was going to end up in nursing from the get-go. My parents, being doctors from the Philippines, it was more tailored to go into the sciences and pre-med and whatnot. So yeah, my undergrad was all science intensive. A lot of it was biochemistry, and never really thought I was going to get into nursing at all. It was only until I started working as an EMT when I was in college. And afterwards, I got into working as an ER tech. Did I really get to see kind of the whole scope of practice of a nurse and how they just ran the entire ER, and that was really inspiring to me. So I started thinking a little bit after postgrad of what I wanted to do, what kind of avenues I wanted to explore, and I just found that nursing was a very good fit for me. I thought it was a good fit for my personality. And what was appealing to me the most was how versatile the role is. You can go from you can become an educator, a clinician. The CRNA was really enticing to me too. So the versatility was extremely relevant to me. I thought that was nice.
Yeah, nursing is the best choice. So you're probably figuring it out now. I went to the best career. You know, you can go into a lot of different fields. So thank you, Vincent, for sharing your thoughts about how you decided to be in the nursing. How about William?
So going out of high school, I was actually going to a career technical academy where I studied or majored in architecture. But then after going through that program, I realized that wasn't something that I could see myself doing for the rest of my life. So when I was trying to choose a major to declare in college, like I combined like my interest in biological sciences as well as like my love for community service. And it seemed that nursing was the perfect fit for me. And similar to what Vincent's experience was, my mom is also a nurse, but I never really got the push from my parents to become a nurse. So I'm glad that I made the choice for myself. And then to add on to what Vincent also said, I was also initially interested in the CRNA path, but nursing in general, I feel is like one of the most personally fulfilling careers, as well as a place to provide continual growth for skills.
Wow, I have good news for you. I have classmates in undergrad who wanted to be doctors, and one wanted to be a CRNA, and she is now a CRNA. So don't stop. After you finish your BSN, you can still go for it. That's the good thing about it. Thank you for sharing your experience, William. What about Brandon?
So yeah, so shortly after high school, I didn't go to college like normal. I took about 5 to 6 years off. The whole time I was working at least 2 jobs, 80 hours, serving tables, construction. My last job before school, I was working in the oil fields, and I was making great money, like really good money. But I was looking around, left and right, and seeing guys like 30, 35 limping, just unhealthy. I'm like, I can't be doing this forever, But I had no idea what I wanted to do. So I moved back from California back to Vegas and said, you know what, I'm gonna try to sign up for some classes. I always enjoyed science. So I just figured I'd take a few classes, see how it goes. Took my first class, Bio 189, and I was absolutely hooked. I love science. And I figured, you know what, I like helping people. I like, helping people feel good. And I was thinking about nursing because it's something where it's stable. You can make good money. You could help people. It's something you could constantly learn every day. You're never going to get bored with. Kind of what Vincent said. There's so many different routes you could take. You become an educator. You become a manager. There's so many different fields. You could travel if you want to. And to me, it was like a no-brainer right then and there. So right now, my mindset, as of like 2 years ago, kind of what William was saying, I do want to go with the nurse anesthetist route. So that's my goal in mind.
Thank you, Brandon, for sharing your thoughts.
Yep.
And we are looking at, there's an increasing number of male nursing students. And I know when we look at the statistics for Roseman University, we are having, at one point, I had like 4 male nursing students in my clinical rotation, which was not usual in when I was in undergrad. And also we are seeing a lot of second degree nursing students overall. So it's a good time to be in the nursing program, right? So now that the 3 of you, thank you, William, Vincent, and Brandon, for sharing your experience and what prompted you into nursing. So now that you are in the nursing program, how are your experiences being a male nursing student at your school and also during your clinical rotation? So let's start with William.
For the most part, I'd say my experiences being a male nursing student were overwhelmingly positive. Like, I never really noticed any gap between like myself and my female counterparts, except in like the clinical setting, because there are patients that explicitly express their preference to have like a female nursing student care for them as opposed to a male nursing student. And this was most noticeable for me during my OB rotation. And I mean, it's understandable and we have to respect those preferences. But through nursing school, we're able to learn the ability to kind of have them articulate why they have those preferences and hopefully convince them to let us like care for them, because that's what we're here to do as nursing students and as nurses in general.
Yeah, and we are focusing on patient-centered care, right? Mm-hmm. So we always have to go with what the preferences of our patients and their families. So we always have to consider the family as well. Very good. How about Brandon? What has been your experiences so far?
So as far as the OB rotation, I agree 100% what William said. That definitely happened a lot where they'd rather have a female counterpart in there. And I understand, but for like the most part, all my other rotations, I had a great time. I felt like actually things were a lot easier because, we're more of a minority. So the nurses training me, I got to do a lot more skills. Like they grab me out of nowhere. Hey, you want to help move this patient? Oh, you want to do an IV later? Oh, you want to try to do a catheter? Especially when I went into the ER, like I just got grabbed for a whole bunch of stuff. And I'd be doing a rotation with another female student. And she's like, I never got asked that. But me and my other buddy, Ben, who's in my same clinical group, we got grabbed all the time. And so it's always been a positive experience. I just felt like I got more exposure. So I loved it.
That's good. And, it reminds me when I was working at bedside, we always pull out our male nurses. I work at Tripler Army Medical Center. It's a federal hospital back in Hawaii, and because you have the muscles, right?
Yeah.
So we always tend to pull out the male nurses to help us with turning over like 400 pounds patient,
Mhm.
that's a lot of, manpower and muscles to be used. So thank you for sharing that, Brandon. How about Vincent?
Yeah, I'm not as far as they were in the programs. I didn't get to do my OB rotation yet, so I can I'm drawing mostly from my work experience. And honestly, I've been really fortunate enough to be surrounded by a lot of male nurses, even back from San Diego and here in Las Vegas. In the ER, a lot of the nurses are male. I don't really see a huge difference, and it's great to see those kinds of role models and that kind of diversity. And to me, it feels pretty interchangeable. No one really makes a big deal, even the patients, about whether you're a male or female. A lot of it is just who can provide care, which I think is really great. For me personally, I think my like Brandon had said, experience has been really great out here. Nobody really is too harsh about being male or female, and to me personally, just coming into it, it was all about kind of examining and reflecting on my own insecurities and feelings of masculinity and whatnot, and kind of just carrying myself with confidence when I go out and about and just say, "Hey, I'm a nursing student. I'm here to help you." Ultimately, that's what we're all here to do, is to provide care. So I'm happy that I haven't really run into those big blocks of any big gender differences or disparities yet. So so far, very positive. I'm looking forward to the rest of my clinicals and everything.
Thank you for sharing your thoughts, Vincent. I think the society now, patients, family, all around globally, because of the increasing number of male nursing students in the healthcare setting, it's now being accepted. And still, when Brandon and William mentioned about the OB population or obstetric population, where they still prefer female, nurses or female nursing students to take care of them. A lot of it, I think you would agree with me. A lot of it is cultural. You
Yeah.
don't want a male person looking at you in your most private, body parts. And I think it's the culture also has to do with that. Otherwise, I think that for the most part, the society is now accepting male nurses in general. Okay, so our next question that we're going to follow what we have here. So, do you think being a male nurse will contribute to the advancement of the nursing profession, and why? I mean, it's a no-brainer, but I wanted to know your thoughts and perspective as a male nursing student and soon to be future professional nurses out in the community. What do you think, Brandon? What do you think? Do you think
I
that?
think
Go
I think
ahead.
this is a very good, unique question. So with this, kind of like what we were talking about the last question, with diversity and everything like that, I think having males in there add a little bit of spice to it. But more importantly, like we were saying about the OB, how some women only want to be looked at by other women in their most vulnerable moments. Well, some guys are like that too, right? But they may not be as outspoken. There's been many times where I had, my female co-students in there taking care of a guy. They actually asked for me, just when doing something simple as like catheter care and stuff like that. Not everybody's like that, but like you said, everyone's different based on, their values, their culture, their cultural system and stuff like that. So I think by having a mix of males in there, it's definitely going to help the patient population. It's going to make them feel more comfortable. And as nurses, I think that's, what we're there for. Try to make them feel at home when they're already in a place where, their hospital they don't want to be at. Just try to make them feel comfortable and, happy about their care.
Well, we can't take away the macho type, right? Sometimes my experience working at bedside is we had this police officer. I don't mean this to demean police officers, but they have so low tolerance for pain. I don't want to generalize. It's men's health. So sometimes they would they don't want to look at the needle. So
Oh yeah.
yeah. So
Big
what about you,
time.
Vincent? What do you think about?
Yeah, I mean, obviously, yes. I think that having more males in the field will definitely contribute to the advancement. It's interesting to me when you are in the hospital and you see like X-ray techs, respiratory techs, even like the EMTs and CNAs. it really doesn't matter about male or female. There's a pretty good spread, especially with like respiratory therapy or X-ray. And I would love for male nurses and nursing to kind of follow suit with that, where it's a big 50-50 split. It doesn't really matter here or there. I think what is interesting or really inspiring to me is social media these days. There's a lot of accounts on Instagram where they hashtag the men in nursing, and if you just explore the hashtag, you get to see a lot of nurse practitioners or CRNAs who are male, and they're all over the place. They're encouraging people to follow suit, and it's becoming very normalized now to see a male nurse practitioner provider. My dad here works as a NP, and so does my uncle here in Vegas. They both work as NPs, and they have great experience, as well as in the ER. Over here, I usually see like male PAs, and this was the first time I saw a bunch of male nurse practitioners, and I thought that was great. It was really cool to see role models in the field, kind of encouraging others to follow.
I'm glad you mentioned about nurse practitioners, and I do have friends who are friends from UNLV who are just finishing their nurse practitioner program. And I also, in the past, I don't know, I haven't looked into it, if there are more male nurses in the in prisons, because I think, working, it seems like male nurses are being categorized as working in the ER, as Vincent and Brandon mentioned earlier, also working in prisons, because it's very dangerous, right? Even for male nurses, it's dangerous. So those are some areas of where the male nurses are being categorized to be working. So
I agree. When I first moved here, I actually worked in one of the county jails for a good like 2 weeks. I lasted 2 weeks, but I worked in booking as an EMT in the front, and I did notice like a large amount of male nurses that work there and providers. So that's interesting to note.
Yeah. So okay, thanks, Vincent. How about William? What is your experience so far? Or what do you
Well,
think? Do you think the male nurse will contribute to the advancement of the nursing profession?
I do believe that more male representation will advance the nursing profession as a whole. Like Vincent and Brandon already touched on these points, but just the unique skill set that some males can provide, because we all have different backgrounds and cultures and perspectives. It'll bring a lot more of a holistic sense of care to all patients across all populations of patients. And then it all really starts with breaking that stereotype that nursing is a field that predominantly females go into. And by kind of making that statement that you can't really put a gender on, as Dr. Tan would say, tender loving care, it'll just show like how indispensable the work of nurses are each and every day, like no matter what gender of the nurse is.
Yeah, things have changed, and I'm glad you mentioned Dr. Tan, because he is one of the founding members for the Many Nursing in Southern Nevada. So I don't know, Vincent and Brandon, William, are you familiar with the Many Nursing in Southern Nevada?
Yes, I'm one of the founding members of
Oh, good.
when we got inducted. Was that last March? Feels
Maybe,
so long.
yeah. I was there because I'm the director for the education. So I know my friends were, why are you part of the Many Nursing out in Nevada? You're not a man. I go, hey, I support Many Nursing. That's why I'm involved with that. So I have to plug it in because they are our community partners. Pino of Nevada is partnered with Many Nursing in Southern Nevada. So any other thoughts regarding that? Why you think that the male nurse will contribute to the advancement of the nursing profession? Pretty much saturated that question, right? So we'll move on to our next question, which is going to be for the benefit of our listeners out there. So if you are just listening to us right now, welcome to Healthy Mondays with Pino of Nevada. I am currently interviewing 3 outstanding nursing students from the different colleges. We have William Gangozo from UNLV, Vincent Ray Tejada from Roseman University College of Nursing, and Brandon. Okay, Brandon Nip from Nevada State College. So I really want to thank the three of you for your willingness to be interviewed during our radio show tonight, because it is a tribute for our men's health and men in nursing. So here's the other question that I wanted to ask the three of you. Do you have any suggestions to male individuals in our community, especially those who are thinking about going into a career in nursing? Let's start with William.
Well, we kind of touched on this at the beginning of the interview. Like Vincent said, that there's so many different careers that stem from nursing. Like, just like Vincent, I never thought that I would go into the nursing field myself, but I'm glad that I made that decision, because there's really a place for everybody, no matter what your interests. Like, going into nursing school, I was always wondering if there was a way for me to get into like the operating room, because that's like kind of my area of interest. And I was fortunate enough to do a preceptorship there in my senior semester. So there really are a lot of different specialties that you can look into, and everyone has a place in nursing. Everyone will find that place. And even if you don't enjoy something that you do in nursing school, at least you know what not to look for after you finish your program. But it's definitely a great field to look into, and if you enjoy taking care of people. And well, I mean, I can't really say anything further than that. If you just like to help people and you like the biological sciences, then why not give nursing a try? It's a great field.
Yes, thanks, William. You know, we just had an orientation for our incoming cohort last week, and I mentioned about 3Ps, not the 3Ps for diabetes signs and symptoms, right? These are 3Ps to help them be successful. So I said passion. You need to have that passion, and there's the reason why you are passionate about helping other people, right? That's the drive that I want to go into nursing, because I'm passionate about helping others. And then with that passion, you can't just be passionate about doing something. You also have to have a purpose. You know, what is my purpose as being a nurse? You know, not only helping others, but also helping each other to be successful, and not only within local and national efforts, but also international efforts. Find yourself some niche. If you know traveling, I'm into that, international mission trips. And also the other P is perseverance. You know, you can be passionate and have a purpose of what you want to do, but you have to persevere, because nursing school is hard, right? You have to pass for Roseman, you have to pass 90% on all of the exams and assessment. So passion, purpose, and perseverance. So Vincent, this is what I'm gonna want to ask you. Can you share with our listeners out there what they can do to prepare in going into a nursing program? Because you all three of you went through that, right?
Oh yeah. I mean, first and foremost, if you're interested in going into it, I say obviously go for it. If it's something that you resonate with, like William said, if you like to care for people and you like the sciences, it's definitely worth exploring. To prep for nursing school, whether you're doing like a career switch, I know a lot of people in my program, I think are mostly career switches. Get your toes wet. Go volunteer somewhere. Maybe consider getting like a CNA or an EMT, or just try to help out and see if you like what departments you like, and see if it's something that you can really go into. And especially with your prereqs, make sure you organize and get all that stuff knocked out of the way, and stay up to date with all of your applications. I think that was the part that's really bogging, is you don't know where to go, what schools to go to, locations, and moving. Like I moved all the way out here to Vegas. Sometimes you just gotta cast a wide net to kind of see where you want to go, and always just, like you said, persevere through everything until you get to where you need to go.
Thanks, Vincent. And you know, some nursing school do interview, because I know
Oh,
Rose
exactly.
City College of Nursing, we have interviews for our incoming students. And that's how we have a feel like before you can even be called in for interviews, we already know that you qualify, that you already met all the criteria. But the last criteria is the interview. Because as a nurse, you need to be able to communicate verbally. You need to be able to articulate information because you're going to be, whether you like it or not, you're going to be an educator when you become a nurse because you are going to educate your patient and their families about the disease process, about any resources out in the community. So you need to be able to articulate and explain and teach and reteach and evaluate, right? Remember the ADPI, right?
Exactly.
Listeners out there, ADPI stands for assessment,
Planning,
diagnosis,
implementation,
planning, implementation,
evaluation.
evaluation. Very
Evaluation.
good. We're doing a review right now.
Yeah, right.
Okay, how about you, Brandon? What would you suggest to our aspiring male nursing students out in the community, especially those who are listening to us tonight?
Well, I would say, number one, kind of like you were saying, is passion and purpose. Don't look at the dollar signs. You got to ask yourself, do I really want this? Because like you said, nursing is going to get to a point where it's going to be hard. And as everyone knows, you might feel motivated, but motivation is fleeting and you need to become disciplined because a lot of people are not just full-time nursing students. Like you just said, the population is getting more diverse. Kind of like for me, I had to work full-time. I paid for my nursing school, going to school full-time. It's going to be hard. And there's going to be days where you're just exhausted. You got clinical, you got to get up at 4 a.m. And these are things you just have to ask yourself because nursing school does cost a lot of money. That's another factor a lot of people, don't really touch up on. So you don't want to mess it up. You want to make sure your head's in the right spot. You want to make sure I write down a list of all the pros and cons about nursing school, what you're willing to go through. You need to have a plan of attack, I would call it, to see how far you're willing to go for your goal. Because, some people have kids and stuff like that. It's going to be rough and it's for a quiet period of time. It's going to be extremely stressful at some moments. So these are just things you should ask yourself. Just like with any goal, it can be achieved, but you don't go in there and be like, kind of like the idea, I want to be a nurse, because if something adversity comes your way or something hard comes, just quit and come back next semester. You're setting yourself back financially, everything else. Real quick short story. Like I said, I took 5 years off of school. I came back. I barely passed high school. And some people might think, oh, maybe I'm not smart enough to be a nurse. You are. I came back to school. I got 4.0 summa cum laude. I found a way to write scholarships, papers, on the weekends. There's always a way to make it work. But you just have to ask yourself, am I hungry enough to make it work? And what am I willing to do? So if you have passion, purpose, you really like really like helping people, it's a no-brainer. I'd say absolutely do it. You can only work 3 days a week if you want to. Like we talked about earlier in the first question, you could be there's so many branches you could go. You'll never get bored, and all the hard work will pay off. So just stick to it and just do it. Just do it. You won't be disappointed. So that's my answer.
I like that, yeah.
Thank you, Brandon. That perseverance and that motivation, it resonates with all of us. I was a single mom when I was in undergrad. And during my last 2 semesters, I was like, okay, I need to cut down my hours. I was a working student, and I cut down my hours from 40 hours to 32 hours to 20 hours. And you can't support your child and yourself with 20 hours working, right? So what I did, I went to my parents and I asked them, can you pay my car loan for the next 2-3 months? And then after I graduated, got my job, so I paid them back. So sometimes you have to sacrifice, but you need to reach out for help. You can't allow your pride to get over you, but you need help. So you need help and ask for help. And then it's just a hoop that you have to jump through in order to finish the nursing program, right? It is hard to go into the nursing program. You really have to study hard. You won't have social life, if anything, because you have to study hard. And also, it's costly. It costs money. So those are the things that you have to think about when you go into nursing school. It's not just fun. It's just not, I'm passionate about this. There's some sacrifices that you have to do.
Absolutely.
Yes. And even male nursing students, because, you could be the breadwinner of the family. So then it's tough. We have nursing students who are male and then they have to balance things. Okay. Wow. Time flies when we're having fun. We still have a couple of questions, but we'll go right through it. Since we are in the middle of the global pandemic, the end COVID-19, How is this global pandemic affecting your thoughts and your perspectives about nursing and healthcare system in general? We can start with Vincent.
Um, yeah, I mean, it's really a crazy time, but it's also a really unique time right now to be in the field because we're seeing firsthand how um, everything from government decisions affect how people react to how your job is affected. At the very beginning of the pandemic, I know that they were cutting all of our clinicals. A lot of us were really sad that we got to end clinical short. But I mean, work doesn't stop. We have to keep going to work. It was interesting here in Nevada to see people at the very beginning were flooding into the hospitals because they were worried about everything going on, and it was just hemorrhaging all of our supplies, all of our resources. We were getting like drained out there really bad. And then for a couple months, everyone started staying home. No one stopped. Everyone stopped coming to the ER. It was crazy, and that affected everyone else too, because if there's no census, then they can't pay people to go to work. So they started cutting hours back. So, and I know a lot of nurses, a lot of my coworkers were had to go on maybe some unemployment or this and that because they were getting cut down hours. I was lucky enough that I was per diem to begin with, so I wasn't really working that full time. So I was still able to get some shifts in. And then as soon as everything reopened again, back to it, the pandemic didn't stop, but the people's thoughts kind of changed, and now we're getting flooded again, and we're looking at that new hemorrhage. And it's personally, I'm like I said, it's a very unique time to be in the field, and you're learning a lot. I mean, nursing isn't glamorous by any means necessary, and this is a good taste of how to deal with something like this, because this will happen again in the future. I'm sure something like this or something similar will happen. It's good that whoever's in the field right now has the training and the experience to go through this. And personally, it is exhausting to always have to be gowned up all the time. You know, it's hard to move around. You go home and you're scared if you're going to transmit it to somebody or a loved one. You're isolating yourself. You're taking off all your clothes in the garage before you even come in the house and running straight to the shower. But it's part of the job, and we all came into the field to help people regardless of what circumstance, right?
Yeah, our lives have changed a lot. Um, everyone's life has changed a lot, and I just panicked when I just went grocery shopping yesterday, and I see people still not wearing their mask. The week before, I went to the mall to get something because coop up in the house. I need to go somewhere, so I'm walking, and there's this pregnant woman who's not wearing her mask, and I just like, okay, So thanks, Vincent. How about William?
Well, with the pandemic going on, like, and as a new graduate, like, I don't think I just speak for myself, but for like the rest of my graduating cohort, that there's like a scarcity of new graduate positions in the hospitals. And I mean, it's understandable right now, like in this situation, because we're like in the midst of a second surge of the virus. So the hospitals are already stretched pretty thin, as Vincent was saying. But I mean, initially going into nursing, I always had the idea that nurses will always be needed, and I still like hold that belief.
Mhm.
But then it is disheartening to see that there are a lack of like new graduate positions. But then from the other side, like a logistical standpoint, like then the new graduates won't get adequate training if they are put on the job with a preceptor. And then that just seems like it's going to be like an endless cycle of like underpreparedness. And then like it's really just a double-edged sword right now. Like you can add new nurses to the field to assist the experienced nurses, but then it could also serve as like a burden for those already in the field. But as for like a positive perspective change, like I'm really glad that I'm seeing like the rise of telemedicine to help access like the um, lower socioeconomic populations. But then this like disproportionate access has become more apparent in uh, in today's world with the virus, because if you get sick, you don't want to go directly to the emergency room anymore. Most people don't even want to leave their houses. Well, I mean, now a lot of people are leaving their houses and not taking the necessary precautions. Like thinking back to a couple months ago, like in March, like no one wanted to leave, and then now everyone's like wants to enjoy their freedom, so to speak. But overall, I think we just need to put more emphasis on prevention rather than having like this like reactionary measures going on with the virus.
Yeah, you mentioned a lot of excellent, points about how we are all individually affected with the COVID-19 global pandemic, and we're only sharing our perspective in the local and national level. I do have a lot of friends in Africa, in Uganda. I'm actually supposed to be there teaching. I teach there every year during the summer in the Masters of Science in Nursing for the nurse education program, and here, thank goodness for advanced technology. We're able to continue your education. We're able to continue checking up on our patients with telehealth. But over there, the internet access is very limited. So the university that I taught at, the internet access is okay, but what about the other people? What about the other population out globally, internationally? So my goal as a nurse educator is to also make our nursing students and everybody in the nursing field and healthcare field to be aware that we are not isolated. Whatever is happening in Africa, in the Philippines, in other parts of the world, we are affected. So we just have to think about that. And also, since we're talking about men in nursing, there's also an increasing number of men in nursing in Africa where I taught. So that's really exciting times to have a lot of male nursing students who are going to be future male nursing professionals. So did we get Brandon's perspective?
No.
Okay. The floor is yours, Brandon.
So yeah, William and Vincent made some really great points. Just on top of some things from the positive aspect, it just shows how resilient we are and strong we are as nurses, which shows that how we're able to adapt. Like no one was ready for this virus, and we were able to finish school and just go through a lot of different adversities and struggles, and it just shows how strong we are. As nurses, I think this is a good challenge for us because we came into the profession to help people and help save lives, and this is everyone's scared. The healthcare workers are scared. I remember when COVID first came out, everyone was terrified. They didn't want to go into the room, but we know this is our duty. Our patients are looking up to us, and everyone did a great job. Everyone stood up just as nurses should. And the second part of the question, with the healthcare system, I definitely see some holes in the armor, you could say, where we could better prepare, kind of what William was saying. Perfect example of this is with the PPE, for example, and the testing. Some of the tests at some of my friends, I'm not gonna say what hospital, but where they worked at, were taking 5 to 7 days to come back. Well, the big issue with that is you're already short on PPE, and you're using PPE for a potential patient that ends up being a negative rule out. So all that PPE is wasted, and it just you're just getting rid of it. So I think now they're starting to do a lot better. For example, they're having the rapid testing. They're coming a lot quicker, so you could more easily identify the patients. They're also having the precautions a lot better. They're they got a huge shit in the PPE in and things like that. So we are getting better. But initially, that was a huge issue, not having the PPE. A lot of the nurses were reusing the same PAPRs, using the mask longer than they're supposed to be using the mask. I personally seen this. But these issues are getting addressed. And once again, it's just showing how, as a community, we're not folding. We're getting stronger. We're creating. Every problem has a solution, and we're finding solutions to the issue. And I think whatever happens with this virus, even if there's a second wave, we're going to figure it out, and we're going to become stronger because of it. So,
Thank you, Brandon, for your thoughts. It's so refreshing. I'm sitting here and listening to all your perspective, and it's so refreshing to hear it from the three of you, with all the ideas and perspective, and also thoughts to our listeners out there. There you go, mga kababayan and our listeners. You know, all this perspective and ideas from our three outstanding nursing students. I always, time flies when we're having fun. That's my cue. So I hope that the three of you are having fun, sharing your thoughts and perspective on this. So there's one question that I always ask all our guests for our radio show. Words of wisdom, maybe a sentence or two. Words of wisdom to our current male nursing students and aspiring ones. I know that you have already gave some, but last words of wisdom from all of you. Let's start with who did I guess Brandon.
Words of wisdom.
Yes.
To keep it short, I'd say, be hungry, be persistent, realize that your goal, it's gonna, time's gonna fly by, and it may seem like forever looking down the road, but looking back, it's all gonna be worth it. So if you have that itch to go to nursing school, wherever your dream may be, just do it. Do it now. There's never a perfect time for anything. And if you have it in your heart and you have the work ethic, I'd say, start today.
Thank you, Brandon.
Yep.
William?
Well, I'm pretty sure we all know that nursing school is already it's hard. It's no joke really. But the journey getting admitted to the program, it starts from the very beginning, from your undergrad, your prereqs onwards. And it really is a lot of self-sacrifice. And I guarantee that nursing school will change you for the better. You not only learn about all the health systems, but about life in general. Nursing school will really push you to your limits and kind of break you down only to build you back up stronger. And if you do feel like you're at your limit, just keep pushing onwards. And as cliche as it sounds, that's where the most growth will happen for you.
Thanks, William. Last but not the least, Vincent. Words of
Yeah, I agree with these two gentlemen. It really just trust the process, trust your work ethic, and most of all, enjoy the journey. It's fun. It's hard, but it's fun. You may be doing something else right now, or not even signing up for prereqs yet. But every step of the way, find value in it. Work your hardest to be the best at it, regardless what you're doing, and just keep going. And you'll look back years later and say, hey, you know what, that was really great. I grew a lot from that. And that's my last 2 cents right there.
Great. It's really so refreshing to hear perspective from the three of you. And again, time flies when we're having fun. But I hope that you enjoyed this interview. And I want to thank all three of you and best wishes with your career. Make sure you reach out to your professors for your letter of recommendation. It really weighs heavy in getting a job and all that. And once again, PHLV Radio for partnering with us as our community partner to bring information to our communities out there. And remember, every Monday, we have 3 special guests tonight. And remember, every Monday is a healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with Apina of Nevada.